As the coronavirus pandemic continues with still no cure, the maker of the recently approved drug Remdesivir says it is now working with companies to expand its manufacturing. The drug is showing promise in treating the virus. Today I spoke with an infectious disease physician at JFK Memorial Hospital, Dr. Cvqa Hawthorne. Dr. Hawthorne, thank you for joining us.
Thank you. Pleased to be here.
What can you tell us about the drug Remdesivir? How does it work?
So right now we are segueing into a new era, a new phase of COVID-19 management. And it looks like Remdesivir is sort of signaling that transition. So basically Remdesivir, it is what we call a broad spectrum antiviral agent. It was developed by Gilead in 2009. Originally, it was going to be a potential treatment for hepatitis C. Clinical trials didn't bear out. So since then, we've discovered that it actually has effectiveness in vitro and in animal models, and also now in human clinical trials, it has effectiveness against COVID-19. Now, I want to, sort of go into the announcement that was made by Dr. Fauci, suggesting that Remdesivir actually proves to be effective. In the NIH study, it was shown that the patients that received Remdesivir fared better than those who did not, meaning that they had a faster rate of recovery. Okay, and they defined recovery as the ability either to be discharged home or return to normal activity. So it looks like for the Remdesivir group that they actually had a 31% faster rate of recovery. And it also showed that there was some survival benefit. Okay, the survival benefit didn't reach significance, statistical significance, but it looks like it's trending towards possibly affecting mortality.
So this sounds promising. Do you agree? Does that give you hope?
Well, right now, this is just preliminary data. We don't have any published results yet. This is basically an interim analysis that was done by the group that is overseeing the study, and they decided to provide this information to the study team. So right now it is looking promising, but I think the thing that is the most promising is that we are transitioning into this new approach to treating COVID-19. Instead of relying on agents in the past that may not be effective, now we're making room for newer agents that potentially can actually alter the disease progression by targeting the life cycle of the virus. So that's what's the most promising part of it. Remdesivir, it may be a wonderful drug, but it may not be the wonder drug that's being touted right now. That still remains to be determined once we've finished with the study at the NIH and get more data from what was generated.
Have you seen a lot of patients asking for Remdesivir?
Well, we do have patients who are asking just in general, are there any effective treatments for COVID-19? And right now, Remdesivir, it is not indicated for any illness at the moment. But what we try to do is we try to not provide the patients with any kind of false hope, and we tell them that there are investigational treatments that are out there that hopefully will soon be available to the general public.
I'm sure demand for this drug is going to increase. Is it difficult to get?
Right now, it is. It's available in limited supply. So Gilead has provided some product ever since the end of January through various pathways. First was a compassionate use program, And then there was expanded access. And now most recently on May 1st, the FDA actually provided emergency use authorization, which means that this provides sort of an avenue for Gilead to actually start providing the drug to a lot more people. So when that goes into effect, or when that is actually implemented, the government is going to be deciding where it's actually distributed.
And before we let you go, Dr. Hawthorne, how are things right now at the hospital with coronavirus patients?
Things are touch and go. We have the full spectrum of patients. We have the patients who are coming in who probably only were going to develop mild to moderate disease. And then they can be discharged home fairly quickly versus those 10 to 15% who go on to develop what we consider severe disease, and those who require mechanical ventilation. We have met with some progress. Even today, we've had some of our first patients that were intubated are now being extubated after being on mechanical ventilation for a week plus. And so I think that Remdesivir, as well as some of the other agents that are coming down the pipeline, provide a lot of optimism.
Great. Thank you so much for joining us, Dr. Hawthorne.
Thank you. I appreciate it.